Hey there, Dr. Anna Maria Helt here at Osada Natural Health, your friendly neighborhood herbalist and microbiologist, and it is our Mushroom Monday. Today I'm talking about Maitake mushroom and how it is being looked at for supporting healthier blood sugar regulation. So Maitake. It means dancing mushroom in Japanese. Take is mushroom, so maitake. And, it could be said that the mushroom looks like it's dancing when you see it. It's a beautiful mushroom. Or it could be that people are so happy when they find it in the woods that they dance. And I certainly did when I found this one I'm about to show you now. I was on a walk, I believe it was late summer or early fall, in Philadelphia, right in the middle of the city in Fairmount Park. And lo and behold, here was this gigantic Maitake mushroom that I'm showing you here, a really beautiful Grifola specimen. And I was super excited. In fact, if any of you saw my lion's mane video from a couple of weeks ago, this was the same walk that I found gigantic lion's mane mushrooms as well. And so for folks back east, towards the East Coast, especially in New York, Pennsylvania, that area, this mushroom can be found in early fall, usually just when temperatures are starting to go down, but it's not getting freezing cold out yet. For folks that actually don't have Maitake growing near them, you can actually buy growing kits and produce your own, or you might even be able to find this in your grocery store if you're really lucky. It's a very delicious mushroom. So Maitake, like other medicinal mushrooms, does have a long history of use in traditional forms of medicine. But the blood sugar regulating aspect, as far as I can tell, doesn't seem to date back that long. And I could just be missing something on that. But as far as I can tell, this comes out of a 1994 rodent study. So diabetic mice were fed a gram of Maitake mushroom powder, dried mushroom powder, per day with their food, and compared to mice that were not fed the mushroom powder. And the mice that were fed the mushroom powder had their blood glucose, their blood sugar levels, start to decline, their fasting blood sugar levels. Also, their insulin levels started to come down a bit, and their triglyceride levels started to come down a bit. This was in comparison to the control mice, where their blood sugar levels continued to increase. They continued to have hyperinsulinemia, or elevated insulin levels. Their triglycerides were elevated. Their body weight was higher. So scientists got really excited about this, as did traditional practitioners. And really, quite frankly, a lot of us herbalists will use Maitake mushroom to support healthy blood sugar regulation. So since then, there have been a variety of studies done in different model systems in rodents looking at diabetes. And not that I'm a big fan of rodent studies for a variety of reasons, but all of these studies have found effects, basically showing reduced fasting blood glucose levels in these mice or rats, and finding better insulin regulation. And so insulin is a hormone that the body makes to allow uptake of glucose into various cell types in the body. And so if you can't make insulin, you can't use your blood sugar, and many of the cell types you need to use that blood sugar in, and you die. This is why type 1 diabetics are dependent on insulin. This is different than type 2 diabetes, where often they make insulin just fine, but their body, their cells are not responding to the insulin properly. So blood sugar then again accumulates in the bloodstream. So anyway, various rodent models that may or may not accurately represent these disease processes in people have found really interesting and hopeful effects using Maitake and various extracts thereof. Now, when we talk about clinical research, there's not been a lot done in people outside of the world of herbalists. But there was a study, well, it was a case report, not even really a study, in one diabetic fellow where his fasting, he was on a diabetic medication that brought his blood sugar levels down to a certain extent, and then he started on the Maitake mushroom, and that brought his blood sugar levels down even more into the normal range, and he was ultimately able to work with his doctor to stop the medication over time, But he continued on with the Maitake mushroom, and I believe it's been at least 20 years at this point, and his blood sugar levels are still in the normal range without the med. Now, I'm not saying stop taking your diabetes medication and start taking the mushroom. You need guidance on this. It can be really dangerous, of course, for your blood sugar levels to get too low or too high, but something to maybe have a conversation about. There's another small case report in 7 folks who are diabetics that were given this SFX fraction of Maitake, SX fraction of Maitake mushroom, which is a glycoprotein fraction of the mushroom. And they were on it for a total of 4 weeks, but a decrease in fasting blood sugar levels was already apparent in them by 2 weeks into the study. This was a completely uncontrolled study, so just be aware of that, and a tiny study. Regardless, everybody's blood sugar decreased, and by 4 weeks into the study, using this SX fraction of Maitake, this glycoprotein fraction of Maitake, fasting blood sugar levels dropped by 30 to 60%. And for the people that stayed in touch with the researcher, their levels stayed down on the mushroom. So I'll mention just one more study done in people. This was published in 2010. Not the best study in the world because it was an open trial, meaning that people knew what they were getting treated with. But this was a study done in women with polycystic ovarian syndrome, or PCOS. This is a cause of infertility where faulty blood sugar, insulin regulation, and other factors most likely contribute to lack of ovulation. And so a person can go for many months without having a discernible cycle. They may have a regular cycle, they may have no discernible cycle at all. In this particular study, it was carried out in about 80 women with oligomenorrhea, which means basically irregular cycle, infrequent periods where they may go several months at a time without bleeding. And so Maitake, this SX fraction, combined also with dried powdered Maitake mushroom, was given as one treatment, and it was compared to clomiphene citrate, or Clomid, which is a very common medication used to induce ovulation in folks with PCOS. And so both treatments, or either treatment, improved ovulation rates in these women with oligomenorrhea that have PCOS, so these women with irregular cycles. So a number of the women responded to one or the other treatment, depending on what arm they were in. But there was a fraction of women in this study who did not respond to either the Maitake treatment arm or the Clomid treatment. And so these women were given both the Maitake SX fraction and mushroom powder and Clomid. And the majority of those women actually responded and had improved ovulation rates. So interesting studies suggesting that Maitake might help induce or help bring on more regular ovulation in women with PCOS. I don't like to use the word induce with respect to the mushroom because it gives people the impression that there's some drug-like effect here where it's forcing ovulation. More likely it's related to the mushroom's effects perhaps in improving insulin regulation in people, because it is that insulin dysregulation that is a contributing factor to improper egg follicle maturation in the ovaries of folks with PCOS, and a contributing factor to some of the hormonal imbalances, for instance, androgen excess that is often seen in women dealing with this disorder. So a pretty interesting study, and I've worked with many cases of PCOS in my practice, supporting the health of these people, and Maitake often does find its way into the protocol. And aside from that, it's delicious. Eat it. You can eat it a handful of times a week and get many of its health promoting benefits, even if you aren't going for a particular goal in using it. It's delicious. It's a great addition to the diet. Of course, you want to make sure that you are cooking it. And one final thing I want to point out before signing off for our Mushroom Monday is that in the little bit of looking that there's been done, clinically speaking, in people in this PCOS study, in these tiny case studies, there were no safety issues found with the mushroom. So there you have it, Maitake and its potential role for helping to support healthy blood sugar and insulin regulation. Of course, as part of a healthy diet and a healthy lifestyle, right? Eating at McDonald's every day and taking Maitake is probably not going to be helpful. But otherwise, maybe something to start including in your diet. Anyway, thank you for watching. If you have any questions or comments, as always, you can leave them in the comments section. I look at all of them and I do respond. And until next time, be well.